Hello everyone and welcome to Inside Healthcare. How did you sleep last night? If you're like millions of people, getting a good night's sleep is not so easy, and left untreated, lack of sleep can lead to major health problems. Joining us is a local sleep specialist, Dr. Tacjana Friday, to talk about this major health issue and what you can do about it. So thank you, doctor, for being with us.
Thank you for having me.
Appreciate it. So first of all, what are some of the major problems with lack of sleep? I mean, what are the causes? What are you seeing in your clinic?
There are a lot of different types of sleep disorders, certainly insomnia, restless leg syndrome, obstructive sleep apnea. But today, because of the increased prevalence over the last couple decades in obstructive sleep apnea, I think it's a really important one to address.
And that is one of the most common ones that you see, or major ones?
It is definitely. There is about 25 million adults today with obstructive sleep apnea, and approximately 25% of individuals between the ages of 30 and 70 with obstructive sleep apnea today, which is a significant amount.
And who's most at risk for it? Who are the most likely to develop that?
Sure. Aging is a risk factor. Family history is a risk factor, and part of that is due to anatomy. You know, what your abdominal obesity, for example, neck circumference, how big is your tongue, or the upper airway structures. Women about middle age actually become equally prevalent to males. Prior to that, males are at increased risk.
And why is that, I wonder?
Part of it is weight gain, part of it is hormonal influences, also diabetes, high blood pressure. Also, your upper airway, you know, you have nasal congestion? Do you have a deviated septum? All those things can also influence obstructive sleep apnea.
So maybe you can tell us exactly what is obstructive sleep apnea.
Yeah, so obstructive sleep apnea is a process where airway is, you're having pauses in breathing throughout the night, and this is due to the upper airway muscles collapsing or occluding the upper airway. And so as a result of that, the brain keeps sensing that there's an abnormal breathing pattern and wakes a person up to breathe. So people might feel like they're waking up gasping or coughing or choking, which it can be quite startling. And if you have a partner in the bed, it's quite frightening. I can demonstrate what it would look like.
Yeah.
It sounds something like this. A rescue breath, which then opens up the airway, and then the person takes a breath and then falls back to sleep again.
So what's happening to their body when this is they're having this night after night or frequently?
Yeah. So what we see is that the sleep is very fragmented, very disruptive. So long term it results in very poor quality of sleep. Results in daytime sleepiness. That's a very important point. So people's mood, people's attention, concentration, they're all affected by this.
But I don't know if they would, you know, like if they have some of those symptoms, how would they think, oh, it's because I'm not getting my sleep at night?
So that's a great question, and one of the key things is if your sleep duration has not changed. So, I always got 7 or 8 hours of sleep, but suddenly you're not feeling refreshed by that. You're waking up, you're tired, you have daytime symptoms of sleepiness. Something has changed in the quality of your sleep that needs to be addressed. And of course, observations by other individuals. Are you having are you having loud snoring or these pauses in the breathing, which are quite frightening for others to watch, but also very disruptive to sleep patterns.
And again, what kind of happens if it's not treated, if you live with this for quite a while?
Yeah.
And does it have to be very long to cause other health problems?
Sure. So part of it has to do with the length of time, also the severity of the apnea, which is based on the number of times per hour that we obstruct or collapse the airway, and that's how we estimate the severity. So things that can result over time would include a big stress to the heart, elevated blood pressure, heart failure, increased risk of arrhythmias. And in fact, arrhythmia is an irregular heart rhythm. And in fact, if we have people treated for a common arrhythmia called atrial fibrillation, it is more likely to fail when you do cardioversions and certain procedures simply because of the stress to the heart. Over time also you can get worsening of diabetes or actually get diabetes simply because of insulin resistance. The sugars they're hard to control simply because of the stress response throughout the night. Other things, weight gain can occur, poor performance at work, cognitive side effects, mood changes, and stroke risk. I don't want to forget that one. That's a very important.
Wow, very frightening. So how do you know if you have it? You have to do what they call a sleep study?
So the first thing is talking to your doctor. I think we are starting to screen a lot more in whether it be your heart doctor, primary care, a sleep doctor, but just if you sense that you're not getting a good quality of sleep, mention that to your doctor to initiate the conversation to get you to the right place. So a sleep study is very valuable if you're concerned about breathing events throughout the night. A sleep study may not be valuable if there are other types of conditions where it requires behavioral changes or modifications and patterns of sleep, or maybe a lot of kicking in your legs. That may not be as useful, but for obstructive sleep apnea, it's essential that we adequately evaluate with a sleep study.
And this you can do at a clinic, or you can also do it at home now. There's a lot of portable units that you can take home.
Yes, there's a home evaluation, and you have to be the right population of individuals to get the home study. And then for the individuals that maybe are a little bit older with more comorbidities or other conditions, an in-lab may be more appropriate, and the sleep physician can help decide which ones are more appropriate.
Yeah, I know a friend of mine, she did the study, was surprised to find out that she did have sleep apnea and did have to go to one of the treatments. So why don't you tell us about some of the treatments that you use to help individuals with that?
I'm going to kind of categorize it in three ways. The first being just conservative treatment, and that's more appropriate if a person has mild apnea. There's also the non-invasive treatments, and then the surgical approaches. So from the conservative standpoint, weight loss is very key, because that will help. The second thing is lateral sleep. What I mean by that is sleeping on your side. Although it may not completely resolve the obstructions, it can help reduce them. Also, head of the bed being elevated, so whether that's by perhaps a wedge pillow to keep your head upwards, or some individuals have beds that actually do this. Moving to the non-invasive treatment options, there's what's called a mandibular advancement device or a dental device, and then CPAP. So perhaps I'll start with
right here.
Correct. So the first is, this is a mandibular advancement device. And as you can see, this treatment is all aimed at keeping the airway open, and it does so by keeping that lower jaw slightly forward. There are many different types of devices, but this one, as you can see, is minimally invasive. The sleep dentist will actually take a mold of your mouth, so it's customized to fit you perfectly. And there is a little screw here that is tightened over time when you work with the sleep dentist to get rid of the snoring, to improve your sleep. And then you come back and see the sleep doctor, and we make sure that this is perfected by doing a study. But essentially, the goal here is, again, keeping that lower jaw forward so that when you sleep, the airway's open and you don't keep getting awakened by the obstructions in your airway. Moving now to CPAP, or what's called a BiPAP. Now these, again, the goal is to keep that airway open, but it uses an air pressure. And people sometimes are very intimidated by the technology, and now they have changed so much. The machines are sleek. They make them look a little bit sexier for individuals, not so big and bulky and loud. They have a little bag that can be easily, people can travel with and carry it around. Here is just one demo of that, and as you can see, it's not a big machine, very easy to use, on and off switch with a couple other features. There is a little water basin that can be attached to this to provide humidified air to make it not so dry, and it's a comfort. This, as you can see, the machine is connected to a hose that can be quite long, so we have, for people that have their beds some way away from the plug, gives us a little bit of flexibility there. And it connects to a mask. There are different masks. So the mask, this one is called a nasal mask. And the nasal mask simply just fits over the nose. And which mask? Well, it's personal preference. It's also, sometimes facial hair, anatomy, and sleep technologists are very good at helping guide this. So again, the nasal mask. There's also this sleek little mask, nasal pillows it's called. And this simply, as you can see, just goes under the nostrils. There's also what's called a full face mask. You can just hand that to me. Thank you. And this goes on like this. and it covers the nose and the mouth. So sometimes this is a very good option if people are mouth breathers and you don't want that air to escape. But there's different mask options. And again, the goal of the CPAP machine is to use air pressure to open that airway.
I would think it'd be so hard to sleep with this, but I guess if you haven't been sleeping, that it probably is very soothing and comforting.
Many people, so there is an acclimation process, certainly. You have to get used to this. There are things that can be done in that phase. Sometimes we use a medication temporarily, but it's also called desensitization, where if it feels a little awkward while you're relaxed, watching television or reading a book, you can put this on, just get used to the breathing, how it feels. So when you go to sleep, it's not, you get used to it, it's not a big deal.
And then once you start this, I mean, are you on this for life, for a long time, or is it something once you do it, you can grow out of the sleep apnea?
Sure. Children, it's slightly different. Tonsils and adenoid removal can take care of their apnea. For adults, it's slightly different. So weight loss is a big thing that I've seen people significantly reduce their obstructive sleep apnea or go from severe to mild or next to none. So weight loss, that's a big feature. And with so many people being obese, it is a very important thing that we emphasize. As far as the length of time, it generally is a long-term treatment option. But CPAP is not the only treatment. There are many others as well, okay? But in addition to the dental device in the CPAP machine, there are surgical options if some opt for that. And one is septoplasty, for example. If their airways difficult to breathe in the upper nose, they've broken their nose or what have you, that may not treat the obstructive sleep apnea, but improve some of the snoring and the breathing. There's also what's called a UPPP, uvutal-palatal pharyngeoplasty. It's a mouthful, but it's called UPPP. And that essentially what they do is they go and cut excess tissue around the throat area to open up the airway. And the ENT, or ears, nose, throat physician helps us with that, as well as correcting the deviated septum if that is the appropriate treatment for individuals. The other is the Inspire device, and that is a new technology which is quite neat. And what that is a implantable, like a little generator, implantable device that goes right under the clavicle area. There is a lead that goes to the breathing, so it senses what's going on, records the data, which goes to the generator, which then gives the soft impulses to that upper airway, so that the tongue is removed gently, as well as those soft tissue structures are removed out of that airway, so people's airway remains open and people get a nice, restful sleep.
So it really depends on the individual and what they would prefer, what their doctor thinks is going to be the best product.
I typically start with non-invasive or non-surgical treatments first, but there are other options, and it's definitely individualized according to people's response or desires. And we move towards surgical options if it's something that can improve the quality of sleep and improve the obstructive sleep apnea.
Absolutely, it's so important. So besides losing weight, what other things can an individual do to try to reduce their risk of developing this, or lessen it, or just better get some good night's sleep?
Yeah, so good diet, good exercise, making sure as well that we are seeing a doctor, we're addressing our heart health, we're addressing our brain health. So all those things definitely matter, and things to look for are, do you have high blood pressure? Do you have diabetes? Have you had weight gain? Do you smoke? Those, some of these are modifiable risk factors. We can't change our gender, we can't change that we age, but we certainly have influence on those other things. I also want to mention that there are factors that influence obstructive sleep apnea as well, such as alcohol. So binge drinking or excessive drinking, that will absolutely worsen this process.
We're going to be talking with the doctor shortly about binge drinking. So.
Yes, and that's very important. So if somebody has obstructive sleep apnea, this will worsen. There's also some risk with surgery and medications and anesthesia. So if you have obstructive sleep apnea, it's important to discuss that with your doctor so that they can appropriately monitor this. So those are some of the modifiable versus non-modifiable risk factors for that. But talk to your doctor if there are changes in your health, changes in your sleep pattern, so that the appropriate evaluation can be done.
And you definitely don't want to leave this untreated when you're talking about heart problems and all the other conditions that you can develop. So
Yeah.
very serious. So if someone wanted some information to you said that often they can go to their primary care doctor, but when they see a specialist like yourself, do they need a referral?
It would probably depend upon the center. Often you can do self-referral or a referral from a physician. And what we do there is we meet with individuals, we get a comprehensive sleep evaluation. Often people come to me and say, "Doc, I can't sleep." So my first question is, well, let's figure out why you're not sleeping. That is really essential. What has changed? What can we fix? Sometimes it's some behavioral modifications. Sometimes it's investigating different sleep disorders such as obstructive sleep apnea. But getting a really good comprehensive evaluation, and then we're able to direct them with how do we diagnose that, what are some of the treatment options, and educate them about some of these processes so that they can change their behaviors and improve their overall health. I look at it as a chronic disease management. You know, there's so many, millions of people affected with sleep disorders and obstructive sleep apnea, and it affects us so many ways, as I pointed out, with our heart health and our brain health. And so it's important to address these early on so that we can modify some of our overall health.
And you have clinics throughout the Twin Cities, or East Metro mostly, or throughout?
Throughout, with Noran Clinic specifically, we have multiple, Blaine in the northern suburbs, we have downtown, and Edina, and Plymouth, so we're all over, and then Lake Elmo is one of our newer facilities. But there are many sleep centers all over the Twin Cities. We're fortunate in that way, and so take advantage of that, get evaluated to help your overall sleep and health.
And to contact the clinic, we have the phone number on the screen, so that would be a good start.
Absolutely, absolutely.
Final comments for our viewers.
Well, I want to make sure that everybody knows that as you age, your sleep should not deteriorate. It's very important. You still need the same amount of sleep as you did when you were younger. So if something's changed and you're now awakening and you're tired, you feel like you're not functioning like you should during the day, you know, you have morning headaches, your concentration is poor, you're just sleepy, ask the right questions, talk to your doctor, and get evaluated.
Well, great advice. Thank you. Very important. So thank you, Dr. Tacjana Friday. Thank you.
Yes, thank you for having me.